This is Cassandra Bull. I will be doing my course project presentation for Greg Barnett's Structure and Function, and I will be doing my presentation on psoriasis. Psoriasis is a chronic skin condition that is classified by red, thickened skin and silvery white patches, as you can see here in this picture. There are 5 types of psoriasis that all appear in different ways. There is plaque psoriasis, which is the most common type of psoriasis that individuals get, and that appears as scales with white silvery patches on them. There is glutate psoriasis, which appear as small dot-like lesions, almost like scabbed over bug bites. There is pustular psoriasis, which are very scaly and often cause the infected areas to become weeping lesions. There is inverse psoriasis, which are inflamed patches that most often appear under folds of skin. And there is erythrodermic psoriasis, which is very intense and has a lot of shedding and causes inflammation of almost the entire skin. The most affected body areas are the knees, elbow, scalp, and trunk, but psoriasis can appear all over the body. There are 3 levels of severity, and the severity is based off the amount of skin that is covered. Mild covers 0 to 3% of the skin, moderate covers 4% to 10% of the skin, and severe covers 11% of the skin and up. Symptoms, because there are 5 different types, the symptoms do vary, but the most common symptoms are red, thickened, rough patches, silvery white scales, pitted or dented nails. These symptoms appear most commonly with nail psoriasis. And because of the lesions, they become very dry. They often cause open wounds and bleeding. And some individuals experience psoriatic arthritis, which causes joint pain. Causes, there is no known cause yet, but there are studies being done on families who have a history of psoriasis. And they are finding that these individuals have a certain human leukocyte that may cause the overproduction of skin cells. But other causes that can be related to psoriasis are stress, cold climates. Psoriasis often appear in infected areas, and drug use and smoking. There is no known cure for psoriasis, but there is many treatments available for individuals who do have it to help control their symptoms. The most common treatment is topical treatments, and for individuals who have mild to moderate psoriasis, this is probably what you're going to be using. There is corticosteroid creams, synthetic forms of vitamin D, coal tar preparations, bath solutions, phototherapy, where an individual is exposed to certain wavelengths of light about 3 to 5 times a week, depending on their severity. And for individuals who have very stubborn psoriasis, medication is available. Commonly, individuals will use phototherapy and topical treatments together, and that seems to be very effective for individuals who do have it. And lastly, lasting effects. Because of the lesions that form caused by the overproduction of skin cells, scarring does happen, and as mentioned before, psoriatic arthritis is a thing, which is arthritis itself is painful, but supposedly psoriatic arthritis is even more painful. And because psoriasis is such a very unsightly disorder, condition, a lot of people who have it do suffer from social anxiety because they often think people don't think that they clean themselves, use lotion, stuff like that. So it can affect a person's social life in many ways because of the unsightliness of this condition. These are my references, and that was my presentation on psoriasis.